Welcome to Pacer Nursing Power Hour, your go-to spot for real talk and real tips in the world of nursing.
So plug in, scrub up, and let's go. This is Pacer Nursing Power Hour, where nursing students get powered up. I'm very excited about this episode. I can't feel it. Okay, I know.
So stoked. Okay, so you have a totally different reason to be excited because y'all have been besties for a long time, right?
Oh my God.
15 years.
Yeah, we already discussed how long it's been since I graduated.
Yeah.
We started, this is first day,
Yeah.
first class
Yeah.
of nursing school.
No way.
Like in 1991. I don't even think you were like.
I was born.
Were you born?
I was born 89 baby, okay?
89.
Okay. Well, we were definitely out of high school. Yeah, both of us didn't have a conventional 4-year.
No, we
Mine
took
was
the
6
long
and a
way.
half.
We
Yeah.
took the long way around.
Yeah.
Oh wait, what?
Marine science.
She was exercise science major to begin with too. Yeah, pretty funny. Me, I was gonna be a stockbroker. Okay, let's get into it.
So today,
Happy Halloween. This is their favorite Halloween. Like they're that
y'all go all out.
house.
So y'all like decorate everything.
We dress up.
It's insanity. Like
Definitely. I love how I think it's the one holiday at the end of the year where you can actually enjoy it. It's not like as stressful as hosting everybody, but you still do. You can have everybody over and you dress up. It's just like a good time.
Okay.
We get like 15 kids, but that's okay.
They do it for
Because we
themselves.
put out a whole.
I mean,
We play music and we dress up. Like we were Beth and Rip one year. We were Caitlin Clark and Angel Reese. Oh yeah.
it's insane. And it takes him. He'll start putting everything up. What about 2 weeks before?
Oh my god.
Yeah. So it's insanity. Now me,
Yeah.
I'm the one that.
Oh, I have shows coming to your house. So we live like a block away from each other.
Oh, okay.
I am gonna come ring your doorbell.
We won't even be there.
Oh my gosh.
Hate it.
Well, I bring Will some candy.
No, Will goes to his other grandfather's house.
Well,
this year things may change.
I mean, I have to start.
No, I'm not doing Halloween. All of our neighbors are like 90.
The best thing is to scare the little kids. Joey dressed up as Michael Myers one time with a full-on suit and the mask and came around the corner with like a machete. And this 5-year-old ran for the hills. That's the best thing.
I'm telling you, he's something else. They're ridiculous with Halloween. Ridiculous. I'm like Jeff and I know now.
Perfect episode for you.
I know. Jeff and I just go, okay.
So today's episode is called Code Boo Nursing Nightmares. And we're swapping war stories with critical care nursing. We've all spent time in critical care. And so there's all kinds of chaos that goes with that, as we all know. But we're going to share with the students and our listeners our experiences, the ways we've dealt with those experiences. And then at the end, wrap it up with some advice to future nurses or current nurses that are living that life. Thank you to all of our new followers. We've been going at this a couple months. We're super appreciative of all of you. If y'all have any feedback, please shoot it our way. We'd love to hear it. But let's get to introducing our guest.
Yes, and I get the pleasure of doing that because all of you have heard me talk about my nursing loves. In fact, I've even named her. This is Tracy Winchester. She is the nursing love for me. We have been through everything together. We sat together on our first day, first class in nursing school back in 1991.
It was yesterday.
Yeah, and we were the complete opposite. She
Really?
Absolutely. She's from Bergen County, Jersey.
Okay. Yeah.
She was
To start there, yeah. That was
a Jersey girl. Big, long hair. I mean, it wasn't as big as you had in high school that I've seen pictures, but it was still big.
Mm-hmm.
And she I'm me. And, I grew up with ribbon belts and,
Oilies and
Miss Manners, all of that kind of stuff. And Tracy's like she was very hesitant, and then we actually ended up living together, and it was
so cool.
The awesome thing. She would wake up Sunday mornings, put on her homemade marinara, and it would like cook all day.
No way.
I swear, if this child calls and says, I'm making bagel ziti, all of our
We're on the
kids
way.
are speeding to her house. Like,
Oh my
in fact, we
gosh.
complain because she haven't made
I
it
know.
lately.
Yeah, Katie's not happy with me.
No, she's not. My Katie is not at all. In fact, she was talking about that last night. But this is Tracy. We have literally been through everything together. We went through school together, cried constantly all the time. The funniest before we even get into it, so our poor kids, they've grown up with each other. They're like, those are my other kids, and my kids are her other kids. And one of hers got married last year.
Mhm.
We were sitting around the table. Was it breakfast or was it for the dinner? And we were talking about one of our stories. And one of the kids was like, do we have to keep hearing this story over and over? Because it was so funny. We were going to, what clinical was it?
Oh, at the VA. You're talking about Geo Tracker?
Yeah. She had the coolest car. She always wanted a Jeep.
Couldn't afford it.
Couldn't afford it because we were like broke. So she got a Geo Tracker, but still the top came down. We're so proud of that car. Like,
Yeah.
we're the
Oh, yeah, we thought we were something.
oh, we were. So we were headed to the VA in Columbia,
Mhm.
and we were just listening to Pump Up the Jam.
Probably.
Yep.
Yeah.
Pump Up.
Oh,
Yeah.
Up.
How'd you
Yeah.
get that?
Yeah.
But that was our
Going down
groove.
Rosewood Drive.
Yep, that was our groove. And we get pulled over, and I'm like, oh, because it's Bergen County driving right here. I'm gonna let you take over the story at this point.
So we get pulled over, and so we're like laughing, and we're also a little bit pooping in our pants because we're like, uh-oh.
And we're in white scrubs.
Yeah, we're in white
White
scrubs,
scrubs.
ready for clinical. And I think it was 2 officers came around.
Oh my gosh.
And they were like,
Because, we were a
"Ladies,
threat.
Yeah.
where's the fire?" And we're like, "We're just nursing students. We're going to the VA."
I was waiting for her to say something else. Because prior to that, we had been in there was actually still record stores back then that sold vinyl, and it was in 5 Points, and we're there. I don't even know what we were there for, dude.
Yeah, I don't know why.
We didn't do that, but we were there. And all of a sudden there's this commotion. And apparently some little dude was trying to steal something.
Oh my gosh.
And I'm like cowering. And so they end up catching him and bring him back in the police. And as he goes by, this thing right here goes, "That's what you get, you little rat pup." Oh my God, we're gonna die. We're gonna die. I mean, so I was waiting for that to come out. This officer, but we still talk about that officer.
Yeah.
I would love to have gotten his badge number.
So did you end up getting a ticket?
No.
Man, I don't know how we got out of that.
I mean, I got out of many tickets wearing my
Yeah, your name
trauma
badge.
sweatshirt.
But anyway, so we've known each other forever, told so many of the same stories to our kids. They could probably tell it better than we could at this point. Our lines probably match because we've been through the same stressors so much together. So she's been the constant in my life. So, okay.
We're the keep it real friends.
Oh,
I
God.
think we're doing the right thing.
Those are
We
good
say it.
friends.
Yeah, I will tell you, I will get a text and it will say, blank, what you doing there?
Yeah.
No.
Let's
I'm like,
reel it in.
okay, gotcha. She's the one who's super gluing that together.
Hey,
We talked about that, didn't we?
Mhm.
Okay.
Oh yeah.
Yeah, so this is her.
Yeah.
She
So
has
good to meet you.
worked at the same hospital for over 30 years now.
I'm in 30.
Yeah, she just celebrated her 30th year.
She's been there ever since you graduated.
Yeah, that was her first job, and she stayed.
That's incredible.
Not in the same unit.
Right,
Obviously, they plucked her for,
Of course. Bigger things.
greater things.
So where did you start?
I started in the surgical trauma ICU.
Okay.
Fresh new grad, stayed there for just about 20 years. And during that time, a few years, closer to 20 years, I became their educator. And then I took a position as the manager of all the educators. And I kind of saw the forest for the trees happening. And so there was a position in trauma administration for a PI coordinator. sort of like quality and risk for trauma.
Okay.
So I was able to be with my people. And actually, the person that hired me was the same person that hired me as a new grad.
Oh my gosh.
So it was like a family.
Full circle.
Full circle.
That's cool.
And there's you can't speak to very many people being at the same place they
Right.
started as a new grad.
Oh yeah, I've never heard of that.
Yeah, not this one. This one stays
That is
loyal to a fault. So,
cool.
and she calls herself a Bino baby because Dr. Bino is the chief trauma attending, and I remember him.
He's retired, but yes.
Yeah, well, oh yes. I don't blame him. I mean, he should have retired like 20 years ago. I mean, he worked so much.
hard.
And he was one of those, even, and I didn't work side by side with him. I would just see him in PACU when I worked in PACU. He was one of those doctors that literally talked to you like a normal person.
Really?
Oh, he was always teaching. Yeah.
That's
Always
beautiful.
teaching.
That's cool.
Yeah. The Y is his favorite letter in the alphabet.
Yay, because that's my favorite thing that is in clinical. Yeah.
It was Y. Y.
Yeah.
He expected us to think like a fifth-year resident.
Mm-hmm.
So when something ridiculous happened, he looked at us and said, "How did you let that happen?" Yeah. So
He held the nurses accountable for the
right. We're
residents.
responsible for them. Mm-hmm. But I mean, I learned 75% of what I know from him, no doubt, hands down.
That's so cool.
And so many nurses. There's only a
handful
that really are called Bino babies because they are so, because he was loyal to them and they're loyal. He was an amazing surgeon.
Well, he made you learn because you were accountable.
Well,
You know, he'd come back and ask you a question, and if you didn't know the answer, he would say, "Look it up." Now, he might come back 2 days later, 6 months later, and he probably didn't even remember what he asked you, but he knew he asked you something, but you knew. You know that you knew this whole time. And so he would just look at you and say, "Did you look that up?" And you would just, "Yes,
sure did.
I sure did." And this is what, and he'd say, "Okay." So you knew the why.
Yeah, that's huge.
That right there is what you call a collegial relationship and how things should be.
Should be.
Absolutely. So she is here because we want to give our perspectives on things that we've seen in each of our areas. So she was in shock trauma forever. The majority of my career was in ER, and then you're also ER, but then also labor and delivery. We were in the same ER, but just
different times,
decades apart. So we've seen some good stuff.
Yeah.
All right.
Yeah, between all of us. Okay, so we have a couple fun questions to kick things off.
Okay.
So Tracy, if you could be anything except a nurse, what would you do?
Well, when I first went to college, I went to Coastal, and I was a marine science major with the idea that I was going to train dolphins at SeaWorld. That's what I wanted to do. Was
that like your childhood dream?
Yes. And you know why? Because you're always tan.
Yeah.
You always look good because you have to be in a bathing suit.
Yeah.
And you get to play with dolphins. So, I know. Well, okay. Thanks for asking.
Okay, yeah, let's get there.
So while at Coastal, I had a course that was like navigation of seawater. And I was like, this isn't training dolphins. I couldn't see the forest for the trees. Didn't know that at 18 years old, you have to learn things to get there. And so I said,
this is stupid.
All this. And so I changed majors like 3 times. One time I was a PE major, and I was going to be a trainer for the New York Giants. And then I said, what am I thinking? These are like 300-pound men. How am I going to, what? No. Then, while I was in class anatomy, during that, I looked at all these nurses from Ori Georgetown Tech that would come over, and I looked at them and I said, I could do that. Like, I don't get grossed out. And so at the time, it was USC Coastal. And so transferring over
the USC system.
Transferring over to USC was a breeze.
Yeah.
And so my boyfriend at the time became a husband, ex-husband. We moved to Columbia, and I went straight into the nursing program.
And then we met.
Destiny.
But I think today I would want to do like a rehab hospital for sea turtles. Because when I go to the aquarium, that's exactly where I go. As I go looking at the little rehab area.
So, yeah, baby turtles are cute.
My brain goes immediately to Finding Nemo and all the turtles in the. Yeah, that's where my brain goes. Yeah, no, I'm not a turtle fan.
Okay, so Tracy, what is your favorite snack while working, and why?
What, yeah.
Okay. Currently, because I'm not at the bedside anymore.
Okay, yep.
So during the day, I do like to have maybe a dark chocolate, or there are these little things. I just one. Just one. Not a bag, just one.
Whoa.
And
That was a
I
style.
know. And then, or they sell at Costco these strawberry yogurt they're called Yogis. And they're like little, they're awesome. It's like a little pack of them. And
Are they frozen? Yeah,
it's like 80
Kind
calories
of like
for a
a
little
yogurt
pack.
covered raisin, but it's a
Yeah,
strawberry.
but it's
Yum.
it's good. Yeah, they're good.
Are they freeze dried or something?
No.
Well,
No,
how
it's
do they
too
stay
chewy.
fresh?
They're not real strawberries.
Ah, okay,
I'm
gotcha.
quite sure it's some
They're
sort of
processed
manufactured
strawberries. Come on, Mary.
thing.
Okay, sorry, my bad.
Now, when I was at the
Stop pretending to be a
bedside,
health freak
Yeah.
over there.
yeah, when I was at the bedside, we had there was a unit right outside of the STICU, and they had a patient and family fridge. And so we would go in there and we'd get the little jelly packs, and we'd get saltines.
Okay.
And you dip your saltine in the jelly.
I'm a peanut butter girl.
Okay, but
Individual peanut
if they
butter.
had peanut butter, the round peanut butter packs, we'd do that. But typically it was just jelly. And so I would take those. Now, last night,
Uh-huh.
go ahead, Mayor.
Last night? Ooh. Let me.
And I was texting Tracy, I'm like, jelly off the floor? Are you
serious?
And I said, reread that. I'm going to give you a minute to reread it. She's like, oh, the fridge on the floor.
I mean, to be fair though, there is that 5-second rule. And we're okay with picking up some candy that dropped on the floor.
Yeah, picked up Cassie up jelly, put it in my mouth and said,
there you go, moving on. Yeah, like it just
Jelly
does your
is great.
immune system. But that's where my brain went to.
yeah.
And
Like I could just envision someone on the floor like licking it.
I knew. I was like, what are you talking about?
I was thinking she used the cracker to scoop up the jelly.
I did.
2 crackers?
Well, no, off the floor. Yeah.
That
The
was
floor.
that was what was going through my mind.
That's
That was so funny.
Mary has to start wearing glasses when she reads her text.
What was your least favorite med to pass?
I mean, I would say KXLE only because who
Ew.
wants the pussies?
Yeah.
Yeah. I mean, it's not even the itself. It's
No.
more like the results.
So in my mind, you're in shock trauma. You have things happening everywhere.
Mhm.
Why would that be? I would immediately think that you would have a what are they called now?
Conversion, but
No, not rectal tubes. What are they called? An evacuation system in place.
Yeah.
oh yeah. Well, we didn't at the time
Okay.
because
Fairly new, right?
I've been a nurse 30 years.
I didn't know that. See, I didn't
So
even know that.
we did not have the thing that I can't think of the name of.
Yeah, what?
It's a
the
rectal
poop
tube.
Yeah,
Yeah.
I think they call it an evacuation system or something.
Yeah.
I think
Mhm.
this is why I don't. Yeah. Anyway,
I mean, we did have it later on,
you
but
just layer up with Chuck's pads.
yes, and contain. When someone went, you had to teach people the art of how to
Okay,
contain.
how would you do that though?
Well,
Yeah.
we would have multi-layers of
Yeah.
chucks, which became unapproved.
Yeah,
later
because
on.
because of
Oh,
pressure
yeah.
injuries. Yeah.
But we would start like if it was a male, you'd have to lift their
Mhm.
penis and scrotum. So you're cleaning, lift, put a towel, and then you're clean. You're just containing. I mean, you're kind of
Did you
working
build up
down.
little walls with the Chuck's pads, like roll and tape?
Tape. No.
Like roll them up
Build a
and then
fort?
you tape. Yeah, build a fort.
No, you just kind of
Make a
took it and
bowl.
you tucked it. We took it and tucked. Like you
Uh,
would take it,
you make a
kind of tuck
diaper.
down,
Diaper,
and then tuck it under, and so you're just away from the skin, and turn them and get it and
yeah, there's an art.
hold it
to
over.
it.
Oh, indeed, yeah.
That's an art.
'Cause whenever
Y'all
you're
have
pushing
other
and you poop,
fluids.
when you're
Yeah.
pushing and they poop while they're pushing,
How often does that happen?
all the time.
Dear
That was
God,
one of my
All the
fears.
time.
so
Yes.
I don't even know if
Yeah.
I did. I don't like.
And I'm telling you, those L&D girls, I mean, I include myself, they're so good at keeping it contained. It is amazing.
And they
The
don't
first
tell
time
you
when I was on orientation, I was like, whoa, that's
how bad.
intense.
How bad. How bad.
Oh, some people poop a lot because you got to imagine there is a watermelon of a head coming down on your rectum, and it's pushing out all that poop when you push. And that's good. That means you're pushing in the right direction.
I'm so sorry for the nurses.
So, young ladies, you might want to fast. If you know you're going in to be doing this.
That is a good PSA.
Yeah.
That's funny.
I can't imagine. Because you have other fluids coming out at the same time, too. When they ask you, do you want a mirror? Like, do I look like it?
No. But some people, it is very effective. It helps them.
Right.
Helps
Focus.
mentally. Yeah, it helps them mentally. Because I don't think most, especially first-time moms, don't realize how close and far away you can be at the same time. And so they're asking like, oh, she almost here. She almost here. And you're like, well, yes, but you got to get up under that lip. Like you got to push around that pubic bone. And once you do that, it flies right out. But when you're pushing, you can see ahead. And the dads or the significant others or the whoever's at the bedside, they're like, oh my gosh, I see here. I see here. Like I see.
Oh my God.
And the mom sometimes needs to see that to be like, okay, I'm not going to be here for 3 days pushing, you know?
No, thank you.
No, I'd just be like, that's not mine.
Yeah, no. That's an evolution right there.
Like,
Don't put a TV monitor up. What's happening right now? Gross. No, thank you. Okay, yeah, KX,
Yeah.
that's a good one. I had to do that. I agree. I hate it. But in the ER, you would give it right before you stepped to the floor.
thanks.
You're
Thank you.
welcome. We know. We're going to give everything to stop fluids from happening in the ER. But then when they go, we're going to let it go. Yeah. Okay.
All right, Tracy, what made you go into critical care? Why did you choose that?
The summer before I graduated from nursing school, I did a externship up in DC.
That was heartbreaking for
Georgetown University Hospital, and I did the MICU up there, and I fell in love with it. I figured out that I was a control freak, and I liked controlled chaos. Like I like chaos, but it's my chaos, and so anybody that walks in, that's my territory.
Sure.
And ever since then, it was just definitely going to be ICU. I didn't discover trauma until I interviewed.
Okay. All right.
Now we're going to get to the meat of it. Okay. So, Tracy, we would love for you to share a funny but maybe scary story or code blue or rapid response.
I had a patient that was not English speaking, and he was in a chair. He had a Foley catheter. He had a central line. He had an art line. And I was going to go to lunch. This was the very last time I ever went off the floor to pick up lunch and sit in the break room. So I motioned to him, not speaking Spanish. I mean, I've learned some medical Spanish, but I looked at him and I kind of motioned like, I'm going to go eat.
Yeah.
Okay. And okay. And he went, and so, okay, I left, and you tell whoever's watching the patient, go downstairs to the cafeteria. I come back up. I go in the break room. I took my first bite, and 2 nurses came running in, and they said, your patient ripped out all their lines and ran across the unit and naked, bleeding, and into another room where there was a window and hit the window and slid down. All in front of, it was during visiting hour. So in front of visitors. But then she goes, but we got this. And I said, I won't curse, but I said, you don't have this. And so I got up and ran out there. And there was blood all down the window. He thought, because in Mexico, if you go to the hospital, you're probably going to die. And so he was afraid he was going to die. So he wanted to get out of the hospital. So he was trying to jump out the window.
So you telling him you were going away.
That was his
gave his
literally.
That is a window.
Yep. Yeah.
Holy cow.
Yeah, that's one story. I have another really cool one.
Okay, tell me.
And so he basically disarticulated his hip. I mean, it took everything off. So got him in, and I mean, he was the one that, it was, balls to the wall, blood, everything. Yeah, he went for damage control surgery just to try to ligate anything.
Cauterize anything. Yeah.
And so he came and he had hemostats of all sizes, like they were holding together areas.
Pieced together.
And so at one point, being an ICU nurse, we like to clean you, get you pretty and all that. And so we went to turn him, and the sound of all the hemostats falling on each other, it was like click, 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 click. And I was like, oh. And then we laid him back down, and then I remember one of the attendings came in and he was like, impressed that we had him alive still. Cause I mean, I'm going to keep you alive. I mean, I'll do what I have to. And I got a headbutt from the trauma surgeon over the patient. He was like, trauma headbutt. And I was like, okay. Yes.
had to figure out what that was. Like,
Yeah.
why would he headbutt you?
Because it was just like the fact that we are like, good job, kind of thing. Well, I left and I came back the next morning and I heard that he had expired at like 1 a.m. And of course, my reaction was, what did you do? Like, why couldn't
I did
you
my
do
job.
that?
Why didn't you do yours?
Exactly.
I mean,
S-
I don't get to decide, but yeah.
EBL. What was the EBL?
I mean, probably leaders.
Yeah,
like
that's what I
many
was
leaders.
thinking. I
Yeah.
mean, he's a
And
femoral
this is back in
artery.
the day that we didn't have mass transfusion protocols. So we
Mhm.
gave 120, 150 units of blood like it was
Mhm.
nothing.
Yeah.
We actually would call a patient, you had 150 over there because we knew we'd given him 150 units of blood. But
150 units.
just PRBCs, yeah.
Wow.
Yeah, I mean, we would
Wow.
exhaust, yeah. Now it's quite different. Now we use whole blood and mass transfusion protocol. But
I literally have
yeah.
no idea what she's saying right now. I have a vague idea, but it's been so long.
I mean, I was trying to evaluate how many units you give.
Yeah.
Yeah. I mean, and actually, I don't know if y'all know what a level 1 infuser is. It's a
Rapid infuser.
It's a rapid infuser.
Yeah,
Okay.
thank you.
It has 2 bladders, essentially.
Yeah.
So one is your saline, one is your blood
Mhm.
product, joins together, and
They
you
can
pump
warm
it
up
up,
and everything.
and it warms it, and it compresses the bag.
Mhm.
Sort of like the old way where you just stand there and compress the bag yourself. It
Yeah,
compresses the
pulling the
bag.
bag over on itself.
Yes. Well, this does it by pressure.
Okay.
And it will give a unit of blood in about 30, 35 seconds. I mean, and
That's
so once
insane.
somebody has to man that.
Yeah.
And that's not you put it up there and walk away.
Uh-huh.
So I loved the level 1. So that was my baby. And so any big trauma, I was like, I got the level 1. And this is also back in the day where we did not have like red bags and,
Mhm.
all sorts of hazardous things.
Do you throw everything in the garbage can?
I would put a big round trash can behind me. And as we were changing them, I would just flip them and flip it back over my head into the trash can. And I know one of the physicians stood there and said, I don't even know how you're doing this, but you're getting every product into it. And I was like, because I'm in my spot. I was like, I'm in my spot and I'm perfectly positioned.
Like that,
Yeah.
that had to have been like a symphony, synchronous, like epic. I would love to have seen that.
Yeah. Now there is, it's a bit of learning because I have been there where you flip it too soon, and blood starts spraying everywhere. So I've been there, to where you've lost a little bit of that unit because it's just spraying.
And it's in your hair.
Everywhere.
Oh my gosh.
Yeah, no, I do remember first time I ever saw a chest cracked.
Mhm.
Actually got to do a cardiac
Mm.
massage.
Nice.
And yeah, I was like totally down. I mean, it looked like I was a victim when I came.
I bet.
Even though you don't, because in that hospital we didn't have enough. We knew they were coming in hot,
Mhm.
but we didn't know like the like
The
how
severity
bad.
of that. Yeah.
So
What
when
temperature
EMS was rolling in going, we need trousers, I'm like, what is happening? So we put them on and she cracks his chest. And we are literally two nurses are pulling blood out. This was before the rapid infuser, pulling blood out of the bags. And we are literally slamming them in with 60 ml syringes. Like,
Great.
pushing it. I'm just pushing it. And there were 4 of us doing that. And then we would rotate helping the doctor with the bundle massage, cardiac massage, and not bundle. I'm thinking.
I was about to say. I know there was no bundle. I'm not a married girl.
Yeah. So yeah.
Mhm.
That's the only time I.
Yeah, I happen to have a string of amputations because we had another one that
With waves.
Yeah, well, and I mean, I just happened to be the one that was always involved in some amputation of some sort. I came walking in one morning, I was going to be in charge, and I go and I see there's a lot of commotion going on in the rooms, and I look in there and I see the ED nurse by the bedside. I see the physicians, they're getting ready to amputate or finish off the leg. And
At the bedside?
At the bedside.
I did not know that occurs at the bedside.
If it's traumatic amp, they can do that, and then they'll take them to the OR for a
Okay.
revision and all that. Do
Okay.
it pretty. And I look and I go to walk in the room, and it's one of our very large 4-bed rooms, and I see like all of the ICU nurses lined up next to the big Pyxis. And I looked at them and I was like, what are we doing? And, and they were like, she won't leave, the ED nurse. And normally they drop off, leave.
Yeah, we're out of there fast.
In your unit.
Yes.
The
Yes.
patient.
Yes. So I walked over to her and I tapped her on the shoulder and I said, hey, hi. I said, there's like 10 ICU nurses over here. we're good. We got this.
Yeah.
And she goes, what am I supposed to do now? And at that moment, the leg came off. It is. Yeah, at that moment, the leg came off, and one of our nurses said,
Oh my gosh.
here, you can take this. Handed her the leg, and she was like, oh my God. And she left. It is epic. Here, hold this, why don't you?
I wonder where she would put that. Wonder where she put that.
I don't, it was just so classic. We had another one. I came walking in again. I was orienting somebody, and I look at the assignment sheet, and the person that was in charge was standing there, and she looked at me and she said, I need you, I need you to do something. And I said, what? And she's like, this guy's going to die. They won't listen to me, and they listen to you. And I
Who
said,
is they?
trauma surgeons.
Okay.
And I said, well, it's very simple. You tell them I need your butt up here. They're going to die.
Yeah.
Like I don't rose color it. So I had an orientee. This was he had a traumatic amputation. And as I walk in the room, I see his heart rate going 120, 80.
Oh, no.
And when it was like, it was like 120, 180.
That's the worst feeling when you see
yeah.
that.
And I called the resident and I said, I need you up here now. And he came running in, like, I don't know where, and he like matriculated from somewhere because he was there before the heart rate hit 60. And he started coding. And so he said, let's go. We're going to the OR. So we're packing up. And at the same time, so the girl I was precepting, she jumps up and she starts doing compressions.
Mhm.
And so we're rolling down the hallway and we're yelling, calls an elevator, because you could always call ahead with an elevator. And we stopped right at the elevator going to get on. And I looked at her and I said, get off and I'll get on.
Yeah.
I'm thinking you're not gonna have it in you.
Yeah, it lasts that long.
So I jumped on.
Richland's what? How many
It was
stories?
5. 5 floors up, and the OR is on 3.
Wow.
But still,
Yeah.
time. So I said, just, jump off, I'll jump on. So I jump on, I start doing compressions. We pull into the OR, and I'm still doing compressions, and I see the resident coming at me with a scalpel. And I was like, hold on. And as I jump off, and he proceeds to do a clamshell thoracotomy, which is the entire left to right side, and he opens up the chest and he starts scooping out.
Is it?
It just depends on where you start.
Like
It's, oh yeah, no, it's the whole thing. Yeah.
holy.
And so he opens up and he just starts scooping out tons of clots. And at that point we leave. I'm kid you not, it was like 7:17. All this happened in 17 minutes.
Oh my God.
I mean, it was like, and I remember she looked at me and she was like, who needs coffee in the morning? And I looked at her and I said, true though. I said, yeah, that's pretty awesome.
Yeah, that is pretty awesome.
Like all day long I would do that. Yeah.
Yeah,
that was
pretty cool. Yeah, I love doing some compressions on the stretcher now.
But
Oh, yeah.
That gives you like that Superman
Sure,
power.
well, like,
I got this. Yeah, so those are pretty good. I don't think I can talk.
Yeah,
I did have a physician oral facial physician come in, and I had somebody with a little Fort 3. So like every bone in your face is essentially broken, and essentially your nose, this area is free floating. And so he came in and he was assessing, and he said, come here. He said, feel this. He said, take it and just go like this.
Oh,
You literally go like that. He's like, okay, now don't do it again. He's like, but I want to show you what, so that you can, you have a totally idea of what we're saying. And yeah, that was pretty cool.
That sounds like kneecaps with me. Like, I don't do ortho. I can't stand ortho. That's the only time in nursing school I almost passed out.
really?
And I think it was at the VA, and they were doing an ortho procedure and literally whipped up a real circular saw, and I could just see bone shreds flying. And I'm like, okay, yep, I need to sit down. I need to sit down. At that point, I knew I'm like, I'm never going to be an OR nurse. And the pandemic only confirmed that with me. I don't like to have things on my face, and it's too freaking cold.
Yeah, that's true.
True.
Yep.
Very true.
But bless OR people. Bless you.
Is there a moment during these shifts where you just had to laugh or cry or both? Like, how do you react in those moments?
You have to compartmentalize everything because you have to do your job. I mean, there have been horror stories, just ridiculously sad stuff. But honestly, humor I think I use humor more than anything, and because you really just can't make this stuff up.
Yeah,
Oh, you can't.
I mean, you can't.
You can't.
You know, when Mary pushed a chair down the hallway, and all I pictured was when I would take the IV pole and I'd run and jump on it and take it down the
Oh
hallway.
my God, really? Like you did
Yeah.
up and buggies?
Yeah.
I used to do that all.
Yeah.
We would have wheelchair races.
Yeah.
Yeah. And
Yeah.
there's just a certain, you have to relieve the stress.
Right.
And because we didn't grow up in the era of
Everyone
let's
gets a trick.
debrief,
Yeah,
let's talk about how you're feeling.
Yeah.
Sure. Yeah.
It was put your big girl panties on
And
and
move
move on to the next one. And so, you know, sometimes you spend your time driving home crying, you know, if you're kind of rehashing your day. But yeah, I mean, I would think I use humor more than anything.
Oh yeah.
You know?
Same.
And I think you have to. You have, and a lot of times what gets mistaken, you know, nurses doing that compartmentalization, or, you know, you built up that callus of that immediate. But I think what gets mistaken or misinterpreted by our faces and the way we act to the family members.
Mhm.
And I think there's a lot of times I know in my career that I should have had a, a more, I don't know.
Compassionate?
Yeah, maybe, yeah. But you know, at some point you have to be callous about it because you can't take it home.
Well, you won't survive.
Mm-mm.
I mean, you won't survive and you won't be able to go on the rest of your day.
Right.
You know.
Right.
Yeah, no.
Very early on in my career, I had an EMS personnel tell me in this field, which was the ER at the time, these people's worst day is our everyday.
Mhm.
And I think it goes both ways. It's hard for a patient or their family to understand we deal with this for 12 hours in one day, and there's something just as bad, if not worse, going on next door that we're managing while we're in the room with you.
Mhm.
But it's their worst day, and we do have to remember that. And sometimes it's really hard to
It is.
connect with the patient and empathize with them because who knows what was just next door.
Yeah,
Um,
yeah, I'm gonna have to get that charger.
but I think that was a really good statement to hear early on in my career. It put a lot into perspective.
Yeah, we didn't have that.
We didn't have
We
that
didn't have no, like you were eating
topical
up.
moment.
You were eating up and spit out if
Yeah.
you didn't do your thing.
But it's true though, because like when I had Allison and Jackson, my twins were 31 weekers.
Mhm.
And
Oh, wow.
my ex, when they were born, you know, he rolled in and I said, "What's going on?" And he said, "The girl is fine." We wouldn't name her until the girl is fine, but I don't know about the boy. And I said, "Give me a wheelchair." Give me a wheelchair. And I went, and, you know, I mean, I went down to the
On my
NICU.
way.
Yeah. Yeah. And I was just like, I had to take it in and process it. I went full on nurse mode.
Oh yeah.
And he got so mad at me because he was like, "You're not emotional at all. Like, these are your kids." And I was like, I have to understand this. Like,
Mhm.
I have to
Yeah.
switch my modes because I have to know what is going on. I cannot get emotional because if I do, I will not be able to process what's being said. But yeah, I do that a lot. I mean, I've done that.
I did it with Daddy,
Yeah.
and I did it with when Mr. Kennedy passed away.
Mhm.
And I felt like you know, poor Jeff, and I don't know if Joey's the same way. Jeff didn't understand the reality of what it was to be the husband of someone or the spouse of someone that's a nurse,
Mhm.
especially when kind of like I think all of us
Yeah.
have very dynamic personalities, and so the realization when I go into work mode is something that he really doesn't see a lot. Yeah, so it is something that I you have to do, but I hated you hate having to do it when it's your family.
Sure.
Luckily I've
But it serves you well in an emergency.
yeah.
Oh, for sure.
Because I've had a few times, you know, I had a niece that was a baby at the beach and wearing like wings, you know, the
Mhm.
tourist trap store. And all I could hear Martin, Brian's brother, say is, "Someone help her." And all I heard was the high pitched, you know, like, yeah, right. And so what does Tracy do? I don't advise anybody to do this. I went straight in. I
Yeah.
went in and, you know, and I
Yeah.
pulled out a piece of plastic because she had, you know, the Walmart bags they give
Yeah.
you. Well, she had pulled off a piece of plastic and so it was covering. And so, I mean, I just, whoa. And then she started, you know, breathing. But I was just like, I just went into a mode.
Yeah.
You
You just
know, I
like
mean,
your brain just gets triggered.
You do.
You do.
But Joey did not realize that nurses were really not compassionate. I'm like, okay, you're fine. Are you dying? Are you bleeding? And we were in Waffle House one night with Brett and Harper and
The twins.
the twins. And Joey went to the bathroom and I'm sitting and there's an old elderly man on the stool that's right behind where I am in the booth. And all of a sudden I heard a head hit the top floor.
No.
And I jumped up. Like I jumped up and he had a big goose egg already. And I looked and I turned and I looked at the girl behind the counter and I said, I need you to call 911.
Yep.
Joey had come through the doors and I said, I need you to find me something, a jacket, a sweater, something.
Yeah.
And he's like, Tracy, you just started yelling at everybody. He's like, you were like barking orders. You went full on trauma Tracy.
Yeah.
And I was like, I said, well, and then it turned out that somebody was there that was a fireman. So he came over and he had already called the truck, so it was pretty cool.
So we all know we deal with patients. I mean, that's our business. That's what we do. But we also have to deal with family and friends constantly. And sometimes they're the more challenging aspect of our jobs. So can you share any stories that are crazy, bizarre, funny that you've dealt with family members, friends, loved ones at the bedside?
And then there was somebody else it was not my orientee, but I was in the 4-bedroom with, it was my other girlfriend that was a nurse, and it was her orientee, and the patient was brain dead. And so the family wasn't understanding because they still had a couple of little reflexes.
Which is
like pronounced brain dead. So the family was like, I don't get it. They say they're brain dead, but look, he's still moving. Well, the orientee said, well, it's kind of like when you cut the head off a chicken and they still run around. And both of us are standing, her preceptor and me are both like, what in the hell did she just say? And the family went, oh, yeah, I get it. And we went,
oh my gosh, that was not therapeutic communication.
No, I was exactly.
They
understood, and sometimes you have to break it down to whatever level it is that the family understands.
That's
so true.
Health literacy.
Health literacy.
And I mean, I'm going to
use smarty pants doctorate degree.
Props to the orientee for realizing that, I need to break this down. No, maybe she didn't, and that was her explanation. But it worked.
That is fabulous. Right. Okay. Everyone's either favorite or least favorite topic. I feel like as nurses, we always talk about bodily fluids and how much we deal with them.
I mean, that's the one of the primary things you have to deal with.
You have to.
In this profession.
That's the first thing you have to get over.
For sure. So what's the wildest thing you've cleaned up while trying to keep a straight face?
Okay, this does not involve poop, pee, or poop.
So would her eyebrows do that? It buckle up. Like, oh my God, that's some serious stuff happening.
I was precepting. I was a preceptor a lot. And one of the girls I was orienting, we got in a MBC. So as an ICU nurse, we like to bathe you and get you nice and clean and pretty again with the bath.
And that's why I'm an ICU nurse.
So while going through that process, we noticed that he had, you know how tempered glass breaks? It's like little tiny pieces, like little, he had hit glass all in his pubic hair.
Oh, no.
So I looked at the orientee. She's like, oh, he has glass. And I looked at her and I said, when you drive, you normally have clothes on. So normal people don't get glass in your pubic hair. Yeah. So I said, and she's like, oh, he didn't have pants on. I said, no. And so we thought, how are we going to get this out? We took a yonker and we took the yonker off and just used the suction tube and just vacuumed his pubic area. And it worked. Highly effective. Oh my gosh. Yeah. That was probably the wildest.
Back to my whole MacGyver.
And
that's a MacGyver moment. Some students have no idea who MacGyver.
No, but I grew up in Richland, and so you improvise.
Yeah.
You may not have the most high tech stuff, but you figure out what you can do it with what you have.
But we drill all day, every day. Critical thinking.
Yeah.
And that's what MacGyvering is.
Yeah.
Critical thinking skills.
I know.
You have to be able to use your resources in a timely manner. You can't just sit around
and you can't go.
Yeah,
I don't know, with your hands in the air. I know.
It's fabulous to come home.
Yeah.
See, I would have grabbed a comb.
Yeah.
I guess, but I had to get the glass up.
Out of the bed. True.
Yeah.
So I would have been back at square
Yeah.
one. Yeah, my
Yes,
critical thinking in that scenario would have not
Yeah.
served well.
Yeah, I think I would have done the comb route too, just with on my essay training.
Because that's exactly that's
what I do.
exactly what I went.
I'm not. I can deal. I mean, obviously, I can deal with anything. But
Yeah, you
trains
got
are
way too
not my
much.
jam.
You got way too much coming out with your bodily fluids into there.
Oh yeah, I actually had to do an exposure, go down to the ER. The way the baby came out, there was so much fluid behind the baby, and it just, as soon as the baby came out, it just exploded in all directions, amniotic fluid, and it got everywhere, in my eyes, everywhere. Okay, what is one nursing moment that still haunts you in a funny or WTF kind of way?
Okay, well, again, I was precepting, and
Your poor preceptor.
I love it.
and this is my girl. She was my baby, and she's awesome.
Is this someone that I see at parties all the time?
Yes. Yeah.
I love her.
And so I was precepting her, and so she's in there doing her assessment, and I'm kind of right outside the room watching her, and while she's leaning over him listening, he grabs her boobs, and in the way of, I mean, he like, yes, yeah, and I think he laughed and like, and she just kind of stood there, and then she turned and looked at me, and I said, well, I mean, he's a frontal head, and she went, so he has no stop sign, and I said, exactly.
Yeah.
He has no stop sign. So we coined that term.
There
So
you go.
with frontal injuries, you have no stop sign. You have the inhibition thing is gone.
Love
Yeah.
it.
So ever since then, it was stop sign.
Maybe have a permanent frontal lobe injury.
might.
Do you go around honking people?
And sometimes I have no stop sign though.
Yeah.
There's no filter. I have fallen a lot.
Yeah, that's the truth.
Yeah.
Have you ever had a medication mix-up that was caught just in time, or a bizarre order from a provider, or walking up in a cold sweat thinking you forgot a chart?
Okay.
That's a lot of random things. Did that come up?
And I think all of them happen.
Yeah, for
at one
everybody.
point in
Yeah,
your
at some
career.
point.
But there was a patient that was sick as snot. He had like 11 pumps and all kinds of drips
Yeah.
going. And I'm sitting there and I was precepting, different girl. And it's actually the one that rode the patient with the CPR. And so we
That could be thought of differently the way you phrase it.
Sure.
We're not those kind of nurses.
No. So I'm sitting there and I'm at the foot of the bed and I'm counting stuff and something didn't add up right to me.
Sure.
And I said, "Where is your Ansef?" And because she was giving,
Antibiotic.
yes, she was giving, it was like a 30-minute infusion, it was either 50 or cc or 100 cc bag.
Mm-hmm.
And she said, "Oh, it's right there on the bed." And so I lean up and the only thing I see is an insulin drip bag that's empty. So it's 100 cc, so 100 units of insulin. And I said, "Baby girl, that is an insulin drip that you just gave in 30 minutes. So it was like body parts start falling off of her. I mean, she went into a full-on
Rightfully
meltdown,
so.
crisis, like hysterical. And I looked at her and I said, "No." I said, "You're going to handle this first.
Yeah.
Then you can
Then
have
we're
your
going to melt
breakdown."
down.
And I said, "Go get 4 amps of D50.
Yeah.
Give them. And then call the resident, tell him what you did, and we're going to start checking blood sugars every 5 minutes."
Yeah.
So she does, and she calls the resident.
Chili bumps.
The resident goes,
I'm stressed.
he goes, "Hell, I've killed people." He said, "Just listen to what Tracy says, and it'll be fine." So we gave 4 amps of D50, and that blood sugar, checked it every 5 minutes, never dropped below 40.
There you go.
Are you serious?
That was,
oh my God.
nowadays there's algorithms and if this, that. I mean, we did insulin drips by feel.
Yeah.
We didn't have if it's this much, you do this. It was more like, no, it's this. Let's just
Let's
go.
make it make sense.
And
We say that on him. Let's make it make sense.
And critical thinking.
Yeah.
Yeah.
Absolutely.
And so, I mean, I just kind of pulled 4 out of my
Yeah,
butt.
just
I mean,
just get something started.
I thought 1, 2, not enough. 3, 4, let's do 3. We can always fix it.
Yeah.
We can always give you.
Man.
And so I thought, just get 4, give them, and
Holy
yeah.
cow.
And D50 is not easy to put.
No, not.
That's the honker.
Yeah, that is
It's like bicarb. The honker Abajet. Yeah.
D50 is not
But
easy.
I bet that girl, I don't know if it was a girl or guy, I bet that person checks her meds like crazy.
I'm sure she does. Yeah, I remember she left and went and had like a 30-minute crying session.
Oh, yeah, that would have been.
And I remember the nurse manager walked back in and she said, I'm not sure if she's coming back.
Yeah.
And I
Poor
said,
thing.
okay, well, I mean, okay. But I told her
Yeah.
she couldn't leave until we handled it. And I
Yeah,
said,
for sure.
you have to handle this first. And she did. She came back and she actually eventually ended up leaving and moving to like Arkansas and going to CRNA school.
There you go.
Cool.
So, I mean, things happen to everybody.
I mean, yeah, we are human.
Yep.
Mhm.
Stuff happens.
Yep.
Yeah, that's a good lesson though.
Mhm.
Oh
Now,
my gosh.
personally, I can say that I've never had. I'm a cowboy when it comes to nursing.
Mm-hmm.
I'll keep you alive,
Sure.
But I was very cautious, in giving paralytics. Always make sure there's an artificial airway, either a trach or a ET tube. And so before you give it, your eyes go up right around that mouth and neck. Do I have an airway? Because we've
Yeah.
had that happen where nurses have given paralytics and the intention was they were going to be intubated,
Yeah.
but they weren't.
Oh.
And they tried to suck it back out like, I just gave it up because that doesn't work.
So that, I mean, when we're doing a rapid intubation, though, I remember, I mean, but the dog's right there ready with the ET tube, push and suck, and then you can literally see your patient just go
Oh yeah.
motionless.
Oh yeah.
It's like the first time I ever gave a Denison.
Yeah.
Oh yeah.
Their heart stops.
Oh yeah.
So does yours. Until
Oh yeah.
Oh,
Until it
I'm
comes
like,
back. Oh, for sure.
Oh, my favorite saying is like, did you turn it off and turn it back on again? Because that's what a Denison says.
Mhm.
Did you turn it off and turn it back on again?
Yeah. Like a restart button.
Yeah.
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 For sure.
yeah,
Yeah.
yeah, it's insane.
My favorite part with propofol in the ER is they wake up and every single time, hey, when are we gonna do this?
Yeah.
Really?
Yeah.
It's great. Propofol's great. It's
love
fast on, fast off.
Yes, I love it.
I'm a Versed thing.
Well, I mean, I hear you, but Propofol's very fast.
Yeah.
We use it for heads
Michael Jackson.
because they can do sure,
Mhm.
and Prince.
Yeah. Oh, no,
Is
he
it
just
Prince?
fentanyl.
Fentanyl. Yeah. Right.
That's some good stuff too, but it wears off way too fast. I need my opiates to stick around.
You're so funny. Oh my gosh, I love these stories.
Okay.
So we've talked about all of these crazy, insane, sometimes funny, sometimes crying, all these random stories. How do you not let it affect you mentally? When you go home at night, how do you sleep at night? How do you manage all of that? Because you said you put it in a box, you compartmentalize it, but at some point that box may overflow. So what do you do?
And it does. I mean, it does, and it comes at random times.
Yeah.
We grew up in the generation of, put your big girl panties on and move on.
Oh, yeah.
And so I never learned how to debrief or take care of myself.
It's awkward doing it now, isn't it?
It is very
Very
awkward.
awkward.
Like, I still don't do it. But I think that, things like, when I'm on my way home, it's loud music and I'm singing at the top of my lungs. And that's kind of my time to say, okay, let's decompress all this stuff. But, yeah.
Like, I remember us having phone calls and the way that we talk about our days are totally different than how, like, we would be like, can you friggin' believe what just happened today? That kind of stuff. I think those horrible days is when you lean on your
For sure.
your support system.
Why would I?
And someone who understands. It's got to be someone who
Yes,
understands. Because Jeff doesn't get it.
No.
What would you tell new grad nurses? You've precepted a lot. I know you.
She has.
I don't think I appreciated the extent of what nurses see on a daily basis when I came into my career. So what would you tell a new grad nurse advice you'd give?
I would say that when you hear the physicians talking to the families about what's going on, listen very carefully because they have to break it down for the family. And if you're anything like me, because I'm the kind that I can talk to you on a cerebral level, but I have to have it broken down.
Yeah.
I have to understand it on a basic level to then be able to.
Right. The why. You need the why.
And so seeing x-rays, CAT scans, I mean, there were so many times I stood right behind when the physician, because our physicians would all say, here, come look at these. Let me show you and just listen. And then you learned also how to talk to families because so many times we were it. There were, bad news they don't always get. Patient goes to the OR, now patient comes to the ICU, and nobody's really talked to them. And
Mhm.
so, and I never really shied away, but you had to develop a way to tell people bad news,
Right.
and
Absolutely.
yeah, so listening to how they
Yeah.
explain it.
Okay. So we've talked about all of our nursing nightmares. What makes you stay in this career despite all of that?
Mhm. I think for me, trauma got in my blood, and that was it. I would never see myself doing anything different than being involved in either trauma at the bedside, in the ICU, or like what I do now with PI coordinator. I just love trauma. And that's it's warped my way of seeing the world.
Sure.
I mean, I see everything as I probably should have been a risk adjuster for an insurance company because I see everything as a potential problem.
Right.
I'm like, well, this is not going to go well. Or we'll see something, down the street going down the, truck. And I'll just say, yeah, no, that's not going to end well.
If girls would put their feet up on the dash,
That's not going to end well.
that's not going to end well at all.
So I do that, and literally every single time I do it, I'm like,
Oh, I'm going to get amputated.
yes,
Yes.
every single time. That's so funny you mentioned that.
Yeah.
Yeah.
That's a good analogy, risk assessor.
Okay, so here we go, Tracy.
Mhm.
Here's a segment. It's a rapid fire. We call it stethoscope, if I can get it out. Stethoscope hot takes. So whatever comes to your mind first, just blurt it out, okay? One word to describe nursing.
Ever changing.
That's a good one. One thing you wish the public knew.
In my area of nursing, critical care, I wish that the public knew just how much the nurse knows and needs to know,
Mm-hmm.
because they're the ones a lot of time that are delivering the bad news
Yeah,
on the patient's worst day.
for sure. What would you tell yourself? Like, hold on. What would you tell your first day self?
Well, my first day when I walked into the ICU, there was another nurse there, and it was like a shadow day. She looked at me and she said, "You may as well just turn around and go."
Oh,
And I
Are
was
you
like,
serious?
but I want to be here. I was like 25 years old.
Yeah.
Now I would say that it's going to be,
no, stop. Breathe.
I would say it's going to be a wild ride.
Oh my God.
That's beautiful, though. That's beautiful.
Stop it. She never cried.
Oh my gosh. Oh my gosh.
Oh,
The
okay.
emotion.
I mean, looking back, yeah, when I look at it, it's a wild ride that you never saw coming, and you don't know. Mary can speak to this more than I can, but my career took a few turns, but I'm still trauma. Hers has taken different paths,
Mm-hmm.
and you did not foresee that,
Yeah.
in that very first job. You joke.
Mm-mm.
Nope.
No, we all expected to be there.
Previously, I've told students it's worth it. Do
Mhm.
you agree?
Oh, yeah. Yeah. And actually, my daughter was not intending to go to nursing school and decided to. And I think it's because she saw that there's a whole career and there's
Yes.
so many different paths you can take. I mean,
Absolutely.
there's school nursing, there's, hospital nursing, there's doctor's office, there's
Case
case
management.
management. I mean, there are so
Now
many different
probably
routes.
risk assessors.
Yes. Yes. It could be an insurance adjuster at
There
some
you
point in your
go.
life. But yeah, I would
I
say.
agree with you.
Yeah.
When I'm in clinical, I tell students that this women's health is not a lot of people's jam,
Mhm.
But I tell them there's something for everybody in
Mhm.
nursing.
Oh, yeah.
If you get through school, you pass that NCLEX, you can find your
Mhm.
place in nursing.
And I
It
think,
might take some time and it might take some changes, but
Mhm.
yeah, there's something for everybody.
and I think nursing school helped weed out the things you don't want to do.
Oh, for
Like
sure.
I knew for sure coming out of nursing
Psych.
school, I didn't want to do psych, and I
Nope.
didn't want to do community health.
We had Dr. Delpo.
Yeah.
Oh, she was like, we all
Great
remember.
memory.
Like, she would be smoking cigarettes.
Eleanor Delpo.
Eleanor
Delpo.
smoking cigarettes, and we did our psych rotation on Bull Street, the facility that
Oh my gosh.
that's where
Yeah.
we were. And I remember sitting on the park bench, and she would, debrief or whatever with each of us. She would actually drill us, smoking a cigarette on the bench during our clinical outside.
Yeah.
It was the 90s.
Yeah, for
It
sure.
was the early 90s.
Yeah.
I mean, like we all,
Yeah.
that was brutal. Yeah, psych for sure not, but love Katie Mooney.
So
It's wonderful.
I want to personally thank both of you for letting me into this moment with you guys. Y'all are amazing. Thank you so much, Tracy, for letting us chat with you.
And it should be good. I told you.
Yes.
I mean, I have like a lifetime of stories. So,
Oh, yeah. So please, everybody listening, like, subscribe, leave a review, and follow us on Instagram. Our next episode coming up Wednesday is another round of Why Is This So Hard? Can you guess which student's going to join us next? Thanks for scrubbing in with us.